This is Dr. Kevin St. Clair. So now you have some warts. Well, what are your choices? What can you do about them? Well, first of all, again, you don't have to treat them. They are benign and they do eventually go away. If you do wish to treat them, we have lots of options. Let's look at some of those options.
What treatments are available for warts? Well, for this common infection, there are many options, but the reason there are so many options is that none of them are very effective. Now, for a benign condition like warts, it only makes sense to start with a safe, simple, ideally painless type treatments. For instance, there are many over-the-counter products available which contain salicylic acid, which can help kind of eat away the surface of the wart, smooth it out, make it smaller. Brand names that you may recognize include Dr. Scholl's, Mediplast, Occlusal HP, and there are many others. Also, you can try duct tape. There's been a lot written about that in the last few years, and it seems to be the simple occlusiveness of duct tape over time that seems to make the warts disappear. If you wish to try that, we recommend wearing it about 8 to 12 hours overnight, but it may take several weeks to notice an effect. Now, if these are not effective, a visit to your doctor's office is in order. Now, the doctor, too, would probably suggest starting with simple conservative methods, such as treatments that are applied in the physician's office. These include cantharidin, which is a blistering agent. It's painless at the time of application, but it causes a blister that takes a week or two to heal up. Other topicals include podophyllin, which is used primarily for genital warts or condyloma. And lastly, there's a treatment that's abbreviated SADBE, which stands for squaric acid dibutylester. This actually causes a contact allergy or a rash, but over time can cause the warts to slowly disappear. Other medicines can be prescribed by your physician that you take to your pharmacist and use at home. These include imiquimod, which is the brand name of which is Aldera or Zyclara. These are simply immune recruiters. They cause immune cells to come into the skin, and the idea is for these immune cells to recognize that the virus is there and try to bump it off themselves, which is what happens when warts go away naturally. Other topicals include 5-fluorouracil, brand names of that are Effidex, Fluoraplex, and Carac, or tretinoin, which is a vitamin A derivative. Intralesional injections have been used with increasing frequency in the last several years. This is termed immunotherapy. Your doctor will inject a very small amount of a liquid into the wart, which, similar to the imiquimod applied topically, draws in immune cells from your bloodstream into the wart tissue itself, and the idea is again for them to recognize that you have an infection and mount a response against the wart virus yourself. Other injectables that are used less commonly are called bleomycin and another named interferon alpha. There are oral medicines that can be used from time to time for warts. In children, cimetidine is often effective. This is a very safe antihistamine, which is in fact available over the counter now, often used for stomach acid. That can be effective if given for courses up to 12 weeks. Oral vitamin A has been used for many decades in the treatment of warts. Not uniformly effective, and it should be avoided in women of childbearing potential because vitamin A can actually help cause birth defects. Now, there are procedures that can be performed by your physician in the office. By far the most common is called cryotherapy. Cryo means cold. And this is the use of liquid nitrogen applied to the warts, and it just simply freezes them. It causes a frostbite so that the warts will slough off within a week and a half or two after treatment. It is painful, it stings, but it generally doesn't cause scarring, and there's no needles or cutting necessary. Another method is called electrodesiccation and curettage, and this is when the warts are numbed up in the office, numbed up with a shot, which is itself a bit painful. But then the warts are destroyed by an electric cautery type unit and then scraped off. Lastly, laser treatments can be employed, but these also may leave scars from time to time. Warts are very stubborn, and many times repeated treatments may be necessary, or new warts may appear during the course of therapy or well afterwards. Remember though, warts do eventually go away on their own, and treatment is always optional.